Hey nurses, it's me, Dany and my mama Yunos from Group 26 first year second semester. Today we are gonna talk about urostomy, specifically about the epicystostom, and we're gonna talk about how to care about it, specifically about how to change the dressing of someone experiencing epicystostom. We're gonna talk about the definition of this specific urostomy. We're gonna talk about the types of catheter that is used. We're going to talk about the indications and the complications that is needed during this urostomy. So let's move on and let's hear what I have to say about this specific topic.
A suprapubic cystomy, also known as a vesicostomy or epicystostom, is a surgically created connection between the urinary bladder and the skin used to drain urine from the bladder in individuals with obstruction of normal urinary flow. The connection does not go through the abdominal cavity. The complications are accidental trauma on the suprapubic catheter insertion, urinary tract infection, hemorrhage, swelling, infection, encrustation or granulation at the insertion site. Suprapubic catheterization may be required for attempts at urethral catheterization has been unsuccessful, urethral trauma, urethral erosion and urethritis with urinary retention, post-operatively following surgery to the genitourinary system, urethral stricture as a method of bladder drainage, long-term catheterization in some wheelchair-bound patients, and long-term continence management. Those are the indications. Now we're going to talk about the types of suprapubic catheters. Here is the two-way Foley catheter that is self-retaining and has double lumen and an inflation of the balloon. Next, we have a pigtail catheter with suture. You can see the whole overview of the 6 French pigtail catheter at label A. Next, we have the male sort, which is a traction removal device. Lastly, we have a suprapubic catheters with a fixation plate. Now for the equipment for a catheter dressing: small dressing pack, 2 keyhole gauze dressings, 0.9% sodium chloride for irrigation, and a transparent dressing.
Now we're going to talk about how do we want to start on a suprapubic catheter dressing. As we mentioned, a suprapubic catheter dressing is just another fancy name for an urostostomy dressing. So first thing that we have to start is, of course, prepare the materials. Secondly, perform hand hygiene. It is really recommended to use gloves, as we want to have a very safe and hygienic environment. Secondly, we have to prepare an aseptic non-hand technique to prepare the equipment. And the next one is to remove the old dressing. So I'll go on and you'll be the patient. Good morning, patient. What's your name? My name is Dany Imran and I'll be the nurse that will be helping you to change your dressing. Would you want to do that? Alright. Prepare the equipment. Hand hygiene, remember. I'll be removing your old wound, alright? I'll be removing your old dressing. Are you okay with that? Are you fine with that? Great. Next step is you remove the dressing. Afterwards, removing the dressing, you go wash your hands again, properly. The next step is for us to clean the insertion site with the 0.9% sodium chloride solution for irrigation purposes. So pour a 0.9% sodium chloride solution to the swabs and then try to clean it and wipe it really down. So you'll tell the patient, I'll put on a solution so you'll feel a little bit. So is that fine with you? Once the patient gives his or her consent, you can clean the insertion site. The next step is for you to apply a keyhole dressing method around the catheter. I'll be cleaning and dress you up, alright? Good. Then you put on the catheter, a keyhole method dressing around the catheter. After applying the keyhole dressing around the tube, you'll have to put and cover it with a gauze. After you cover it with a gauze, make sure to put on a transparent dressing as according to this picture at the back. Afterwards, you're already done with the dressing, but as nurses, don't forget to always document anything that you've seen. So any condition of the skin, if it shows any irritability, you have to document it and showcase it to your nurse or your registered nurse and report anything if there's anything to be reported on. And always put on the date of the dressing on your report chart so the next nurse would come in and know that when is the last time the patient has been dressed up.
And that's all for this topic. Thank you for watching. Submitted from me, Dany Imran Muhammad Yunos.